Hello and welcome. I'm Joanna Junak and this is GFN News on GFN.tv. For years, Nigeria has been facing increasing human and healthcare costs from the harms caused by tobacco use. Recently, experts at the forum in Abuja highlighted that instead of relying on traditional prohibition strategies, the country should consider adopting a harm reduction model focused on promoting safer alternatives to smoking, a model that has proven effective in Sweden. Uche Olatunji, coordinator of tobacco harm reduction in Nigeria, and Yusuf Adebisi, a pharmacist epidemiologist, are with us today to discuss the steps Nigeria should take to move closer to a Swedish-style tobacco harm reduction model. Hello, Uche. Hello, Yusuf. It's good to have you both on the program. First question to you, Yusuf. Is there any research which supports the application of a Swedish-style harm reduction model in Nigeria?
At present, there is actually a major deficit when it comes to research outputs regarding THR in many low and middle income countries, not just Nigeria. But the thing is that we already know the science. We are clear about the science. So what we need to do presently is to look for ways to adapt the knowledge from wherever it is, whether high-income country or other setting, to see how best low and middle-income countries like Nigeria can actually maximize or learn from this knowledge that we have regarding tobacco harm reduction. The evidence is clear. Sweden is almost smoke-free. We have major reduction in cardiovascular disease, cancer, respiratory disease in Sweden, even one of the lowest in Europe. We already have the understanding. So I think many low and middle income countries need to just learn from their approach, learn from the science that in fact these products are reduced risk, and see how best we can actually adapt the knowledge into our local settings.
Uche, you are the coordinator of tobacco harm reduction in Nigeria. So, what actions does THR Nigeria take to raise awareness about harm reduction among public?
Thank you very much, Joanna. Thank you for having me in this segment. At THR Nigeria, we are really passionate about one thing. It's about helping Nigerians make safer and informed choices. So for us, harm reduction isn't just about statistics or some policies made by policymakers. It's about people. These are real stories. They are real lives about fathers, mothers, brothers, and sisters who are concerned about their siblings' welfare. And that is why harm reduction needs to be amplified in this part of the world, Nigeria particularly. We understand that quitting is completely the best option, and we genuinely and continually encourage that to be the utmost goal. But we cannot ignore the fact that a lot of people find it very difficult to quit, and we are not going to keep hammering on the quit or die approach. That is why harm reduction really matters. It's about providing safer alternatives that is backed by science and to reduce health risk while we keep encouraging total cessation. At THR Nigeria, we are doing everything we can to raise awareness. By organizing community outreaches, online campaigns, and workshops, and we just concluded one. We partnered with KIL in Abuja, where we had over 170 participants, media, policymakers, and individuals. They talked about a lot of real-life stories that concerns life generally, And we try as much as possible to keep the conversation open, where people can genuinely be themselves and ask questions without any feeling of guilt or being judged. And that's about stigmatization that we also talk about in THR Nigeria. And it's a global concern when it comes to stigmatization. We also partner with health practitioners, health advocates, researchers like Adebisi himself, and Dr. Molly, who is also in THR Nigeria field, and even the media as well, to spread one simple message: knowledge saves lives. So we believe if the people have the right information, they'll be able to make the right choices for themselves. Like we all know, it's not the nicotine that causes the issue; it's the combustion. And people would keep doing what they want to do, but we need to give them more information for them to make more informed decisions for their health. And the truth of it is that there are lots of Nigerians who really genuinely want to quit smoking, but because they don't have alternatives, or let's say most importantly, they don't have the right information to guide them to make those decisions for themselves. We need to just put the right information out there for them and give them the right support. Break down complex health topic into simple day Nigerian languages, even if it's in Pidgin, in Nigerian, Yoruba, Igbo, or Hausa, and most importantly, bring compassion to the table and let them feel somebody really understands them without judging them.
Yusuf, what are the main barriers to implementing harm reduction in Nigeria? And how do you think this can be overcome?
At present, there's a major misconception and misperception regarding nicotine, because many people actually attribute the risk that is associated with smoking to nicotine. So there's a lot of work that needs to be done to correct all this misconception and misperception. Because the foundation of tobacco harm reduction is understanding that nicotine is not the culprit of harm to smokers. So at present, there's a major misinformation. And of course, if you look at it broadly, it's because smoking has been known to be a major health problem, causes a lot of health problem, and many people are actually thinking that the addictive component of smoking is actually the one that is responsible for the major harm associated with smoking. So at present, there's a major misinformation, misperception, and misconception regarding tobacco harm reduction. And university has a major role to play in terms of doing the research, in terms of educating the people. In many high-income countries, we know the science. We have clear understanding of the principle behind tobacco harm reduction. And many countries, the UK, Sweden, New Zealand, have been making effort to actually tap into this science, which is solid and is clear. So university in low and middle income countries have a major role to play in doing research, in educating people, in training students as well. Because throughout my stay in the university, there's nothing regarding tobacco harm reduction. So anything I learn about tobacco harm reduction is basically after or my own personal or self-development. So at present, there's a need for the curriculum to be revised so that students, medical doctor, medical students, healthcare students can have good understanding of the concept behind tobacco harm reduction, which is quite very simple. So university has a major role to play in advancing tobacco harm reduction.
Uche, Yusuf has just explained the role universities should have in promoting harm reduction. Do you have any thoughts on that?
The media has a bigger role to play because they are a powerhouse. They have a powerful role to play. The media shapes perception, and when it shares facts over fear, it changes life. That is very important. That's why we believe in the power of media. They are a powerful tool in the hands of tobacco harm reduction, and we cannot ignore that. So by promoting science-based information and giving space for discussions, dialogues, and around safer alternatives, the media can help Nigerians make more informed decisions. Either in print media or on the screen. Those are very important aspects of the media as well. So together we can move the conversation from blame to solution, and that's where the real progress begins, when this information is out there at the grassroots level. So it's very important. They play a very powerful tool. We can't deny that fact.
Thank you, Uche and Yusuf. That's all for today. Tune in next time here on GFN TV or on our podcast. You can also find transcriptions of each episode on the GFN TV website. Thanks for watching or listening. See you next time.